Since there is a shortage of dentists in NHS in United Kingdom, there's a lot of interest among dentists in India to make that move. But there is a lot of confusion about how to clear the ORE and LDS exams. To help clear your confusion, we have an interview with Dr. Sudheesh today. Dr. Sudheesh, along with his wife, Dr. Nandini, started the NS2 Dental Academy with the aim to help dentists make the shift to UK. Both of them, after completing their BDS and MDS in India, moved to the UK for better career opportunities and higher prospects. Dr. Sudheesh has completed his MDS in oral and maxillofacial surgery, whereas Dr. Nandini has completed her master's in pediatric dentistry. Both are currently working in Kent, and Dr. Sudheesh is also the clinical teacher in oral surgery at the prestigious King's College, London. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. My first question to you is, we both know that there are two routes. One is the ORE route and the other is the LDS route to get to the UK. Both of them have exams conducted frequently. What is your advice on what is the better route we take it?
But this question it's one of the most common questions which are being asked by many of our candidates as well. My first answer to that will be book the one you get the booking first. That will be my first answer. Yeah, going forward, to differentiate both the exams, the OREs mainly they have separate components to assess the basic components as well as the clinical components. So your questions are going to be quite detailed in the basic sciences part as well. So someone with the background where, for example, I from old surgery background, so I'm used to studying a lot of basics. So OR is something which I liked preparing for because there was a lot of basics as well. But if you are not into that kind of studying pattern, more into the clinical applications, then LDS is something which might suit you because even though the structure of what all you need to study is similar, but the application of that matter into questions is more clinical based in LDS. So in that way, it would help. The other difference is the number of diets with ORE and LDS. It's more in ORE compared to the LDS. But the good news is that they have increased the diets going forward for LDS as well. So in that way, even that can come in comparison with both of them. But yeah, it mainly depends on which kind of study you would prefer. But both in overall, what you study for both the exams is more or less similar.
Okay, you were telling something about diets. What's that? I didn't get it basically.
So basically, it's the number of exams in a year, how many exams they'll have. So, for example, traditionally the ORE had part one and part two. So there are two times in a year they conduct part one and 3 times in a year the part two. Whereas LDS also had part one and part one. Now they have split the part two. They have split into others. So they have part 1, 2, and 3 as well. So those are different. So even the part two times a year, they have the part 1, and then 2 times part 2, and 3 times the part 3. That's how they have designed it going forward.
Understood. Now you went after doing your MDS, okay? Your wife and your better half has also done her master's here and then shifted. What would be your advice to the audience out there? Is it better to do MDS here, then shift to the UK, or go directly after BDS?
Well, that's again a very good question. So my personal advice would be, if you have this exposure regarding going out to study or to establish yourself out of it, I would say after BDS is the best time, because even after you do the MDS, it would help you with your clinical skills. But to register to the General Dental Council in the UK, you do not need MDS. It's just a Bachelor of Dental Sciences degree. And if you want to pursue any additional degrees, you could do it in the UK according to their curriculum, and that would be much more appropriate to learn here and apply that in the practice here. So yes, my advice would be, if you're already into that mindset, then it's best to do it after you have completed the BDS. Yeah.
Do you think there should be some amount of experience once you complete your BDS, or during your internship or other time you should start preparing?
Yes, you can start gathering the information during your internship time. Like, there's a lot of paperwork involved with these exams before you go for the application process. So that is one thing you can devote your time during the internship. And then your internship clinical hours are considered for the experience when you are going for the application. So that is something which would definitely help as well. So you don't particularly need, they ask for a 1,600 hours of experience, clinical experience, and the internship experience can be utilized for that. So in that way, I would say prepare your application process, everything starting during the internship. And then once you're out of it, you can directly start with the application process. Yeah.
How much time does it take basically preparing for the exams and studying so that you're confident enough to clear the exams?
So in my opinion, 3 months is a really good time. And this provided you are dedicating at least 6 to 8 hours of study a day. And this is a dedicated study every day, and focused with that would definitely help. And I would also recommend to take advice from someone who has passed the exam, or do some courses, whatever resources you have. Someone who has had the experience with the exam is something I would definitely recommend. And yeah, 3 months at least is a very good time. At least I would say. Lesser than that is a bit tight.
Understood. So you were talking about resources. What are the resources one needs or books one needs to study so that they are ready to give the ORE exams?
Right. So the basics framework, to understand the framework of what is taught in the UK, how the guidelines are applied, all that can be found from this textbook, Oxford Handbook of Clinical Dentistry. So this is a really good book. It concises every aspect of dentistry in one small book. So you cannot skip anything from that. So that's the framework. And how I prepared for the exam was the chapters in the contents. You can use that as a checklist as well, where you can get to know what all is remaining, what all you need to study. Everything can be covered. That's for the clinical aspects. And the same Oxford Handbook is there for the basic sciences. That's the Handbook of Applied Dental Sciences. So that covers the basics. Once you are with these two books, pretty much know 80% what you need to read. And then for additional, there are some books additionally which can be referred for few topics. And yeah, there are multiple books which can just for reference, but these are the two books I would strongly advise. And on top of this, the British Dental Association releases guidelines on certain important topics. So those guidelines are available as well. And those are important topics from which you have to read. There are other guidelines as well that like the NICE guidelines. Again, they give advice on wisdom tooth and antibiotic prophylaxis. And these are all particular guidances which all are directly asked in the exams. So yeah, those are the basic framework of the materials. And then as and when you read all the repeated questions, you come across more resources as well.
That's
And
great.
we at our academy, we definitely send all of that to the students when they join the courses, so that they are aware what resources they have to read, and then we guide them. It's not that you have to read all the textbooks. There is more of a smart study which is directed towards passing the exam.
Yeah. So my next question was going to be exactly that. I'm aware that you have a hidden list of resources which you help the academy students with. Okay. So there are these core resources. Do you think what are the other resources you could provide? Now, if I'm trying to go to the UK, joining your academy, what other resources I can expect from y'all to help me with the entire process?
Sorry, is it in terms of study materials or anything
Study
else?
materials, coaching in general.
Yeah, so one thing we have inculcated is to sort out some important topics and questions which are quite commonly asked in the exam. So that's what we have framed our coaching as well, in a way that all the classes covers most of the most important topics which are asked in the exams. In that way, you are confident that you have covered almost 80 to 90% of the topics which are going to be asked in the exam. That this kind of gives a lot of confidence to the students. The other thing is we work a lot on providing the right mindsets to the students, because I usually use this analogy where you're going to a war. If you're going to a war, you have to be prepared with your right tools, everything, and you're going to fight to just win. So that's the kind of attitude we want to put it through in for the students, because that leads to a lot of difference. And in our courses, we give them strategies how to pass the exam, how to solve the questions, how to make use of that 3 hours you have, so that you're not stressed for the last 1 hour and solving the questions wrong. Whereas if you are much more relaxed during the exam, you can solve all the questions and have good time to solve them in a right way.
Understood. Now, usually, all the resources you've spoken about is for preparation. Okay.
Yeah.
Now, imagine once I prepare and study all these things, do you think mock tests are compulsory? And do you help conduct these mock tests in your academy?
Yes, mock test is a really important aspect of the preparation, and we provide mock test as well at the end of the course. So once we have finished all the important topics, we conduct a mock exam. So this covers all the important topics again. They are the repeated, most of them are the repeated questions, which we kind of frame in a different way or in the topics. But that gives them the idea to how to go about with the exam. In that 3 hours, how your mindset will be. It's not exactly, I would say, as the exam, the stress is a bit different when you're actually doing the exam. But it gives them the idea that you have to solve questions pretty quickly to get to that 3 hour mark in that. So we do provide mock exams in our courses. Yeah.
Great. Is there any other approach you guys add during the preparation other than mock exams and the resources you provide?
Well, so what is unique to us is that we kind of give topics beforehand, before starting the class itself. So what you are going to expect in the class. In that way, it gives the students an head start to go through the topics and get the most out of the classes itself, rather than just getting lots and lots of information during the class itself. So in that way, they are with us during the process. And also we teach in a way that we are putting up a clinical scenario rather than just giving the theory out there. So in that way, the retention of the topic is much more to the students compared to just going on listening to the lectures.
That's great. Now, once I have gone through this entire process, I'm in India, you're helping me with the part 1 preparation, I prepared for it, and I'm trying to go and give the exam. What is the process for application for the visa? Before you listen to the answer to that question, do not forget to hit the like button below, even if you're getting one valuable tip from it. And do not forget to subscribe to the channel. The reason being, the algorithm of YouTube then realizes you're interested in such videos to help grow your career after BDS, and will keep on showing those kind of content to you.
Right. So you don't need a special visa just focused on the exam itself. The tourist visa, which is valid for 6 months, is sufficient to give the exam. Yeah. So you can do in your application process of the visa, you can attach the letter of your exam, and that would be a proof that you're going for the exam. But yeah, it's just the tourist visa you need, and that's valid for 6 months. So it's something I tell the students as well, to make use of that 6 months in a way that I when I was preparing for the exam, I was also hand in hand preparing for MFDS. So during these 6 months, in this span of 6 months of the visa, I gave the ORE part 1 as well as the MFDS part 2. That was 2 different time frames. So this visa you should get is a multiple entry visa. That is, in this 6 months you can travel multiple times. So that's how you can utilize it. But coming to the visa, it's mainly the tourist visa which you can go in and give the exam with.
So now you had given the MFDS along with your ORE. Is it advised for people to give the MFD or MFDS exams?
Right. So with the MFTS, it's mainly an exam which would enhance your knowledge of dentistry and how you apply it, but it's not a necessity it's not mandatory to register with the GDC, that's the General Dental Council. So it's just the ORE or LDS which you need to register with and practice in the UK. But the MFDS is always helpful if you have that in later on after you clear the exam to get a job in the UK. Always that's something which would be highlighted on your CV, because you kind of have a knowledge of how the system works in the UK because you're given the MFDS. So the recruiters are aware that you kind of have a knowledge of how the guidelines, everything works in the UK. And also, even with your clinical practice as well, it definitely helps to, I would say, get a really good framework on how you deliver your practice, clinical dentistry as well, because it's much more precise, the knowledge and how you apply it and all that helps as well. But yeah, it's strictly, it is not required for the registration with the GDC.
I understood. So now some people previously used to go for the dental hygienist or the therapist route, try and get into UK and then give up the ORE exam. Now a lot of people are thinking of doing the same thing with non-clinical courses. So they get into a non-clinical course, work, study, and simultaneously prepare for the ORE. What is your take on it?
Right. So first of all, the main doubt people might have with this is that getting with a course would directly make them eligible to register with the GDC, but that's not the case. So they would need to give the ORE or LDS after they have finished their courses, whatever courses they are into. So that's mandatory later if you want to practice general dentistry. So getting into courses is definitely beneficial, I would say, because you are into the system, you know how it works here. And because you are into the clinical or any courses there, you know how the guidelines are applied, all that which you're reading. If you're reading without that from India, it's a bit alien for you to apply. Why are they doing this? Why are they doing that? But that makes much sense when they are here. And also, if they can take time to study during the course itself, so that also has an added benefit that as soon as you finish your course, you can give the exam. You're much well prepared for the exam, and you also are having an additional degree as well while going into the exam and after the exam to procure the job as well. But it's not other thing they would have to consider is the finances, definitely. So if you're kind of tight with the finances, because you need to work out what all you need for the exam itself, ORE exam. It's not a cheap exam, I would say. It's quite expensive, so you need to plan that first. And if the course is fit in that, then definitely I would advise, yes, you can go for it. But again, it's not mandatory for the GDC registration, and the courses doesn't give you any free ticket to go into the ORE. It's the ORE again stays where it is. You just need to prepare for the exam later on as well.
Understood. But what are the job opportunities? We hear that there is shortage of dentists and NHS and everything. Now, I am keen on going to UK. I contact you, help me out. Are there enough job opportunities once I finish the ORE exams?
Right. So this question has been asked by many of my friends itself. I'm hearing that there's not many options there. That's actually wrong. So what's happening is there is a bit of conflicts going on with how the national health system dentistry works, because of which many practitioners are leaving that. Now, the ones they are leaving, there are a lot of opportunities being created. This is especially outside of the London. So every focus is on London and the major cities. That's why the news is that there's no vacancies and all. But outside of London, there are a lot of practices who need dentists, and there's definitely scope. So if you are a bit flexible to move out of the core London, you have a lot of opportunities, and they also pay very well compared to in London itself. So the packages are very good. So once you are out, you definitely have the options. And yeah, I wouldn't say it is out of scope. It's definitely in scope, and a lot of opportunities. Not in the major cities, but as soon as you look outside the cities, you definitely have lots of opportunities.
So now if I join your academy, you all will help me through the ORE part 1, part 2. But what after that? Will you help me or guide me with, or the students who are watching this, with the entire process after that, the job process?
Yes, absolutely. So in a way, this was the main reason we started with the academy and all that sprouted, because when we were preparing for the exam, the first thing I used to be very angry in a way when I used to read all the new guidelines. I don't know, why are they doing all this? Why can't they keep it simple and all those things? And then when I started practicing, when I got into the system and how the appointments work, how the follow-ups work, how the patients' perspectives are, all that, then it started making sense to me why they have given this kind of guideline and why they are preparing us in certain way. So that's what made us realize, okay, so this not everyone knows, and not many of the courses tell you that why they are doing like this. So that's the main reason we started helping people, like thinking, okay, this is not many of them know this, why is it like this, and we need to teach them that one. So we definitely help with that. We also tell them where you can find jobs, which all kind of jobs you look for, what all to ask for during the jobs, because I have changed a couple of jobs now. It's because there are different ways practices work. It's not that they are bad. It's just that you can find jobs which suit you. Okay, so it depends on what kind of practice you are. It's not just how the practice works. It's just what you want to carry forward in your career, whether you want to practice in an oral surgery field or a restorative field, all that. So there are some well-established practices where they have all the specialists in the practice. So if you as a specialist from India, you want to develop your career in that practice, it might be a bit difficult because all the patients will have already seen the specialist there. So if you go to other practice where there's no specialist, so you do have a really good scope there to enhance your specialist career. So in that way, you can get different kind of practices. So that's the guidance we give to the students. What is your specialty, what you want to do, how you want to travel, all that. And then, yeah, definitely we give the advice, even in terms of if they want to pursue any other studies or any other field after, not just the general dentistry, we definitely guide them with that as well.
But that's really great, because this kind of advice is not available. I've seen a lot of people join academies. They basically train them for ORE. They finish the ORE part 1, ORE part 2, and then their own. The best thing what you're doing, Dr. Sudheesh, is you are guiding them even after that, because knowing how to read the contracts, what type of job offer to take, what type of clinic to join, whether that clinic suits you. Now, it doesn't mean that the clinic is bad. It might not suit what you want, is basically what you said. So I think that's very good advice, and I'm sure you're doing a great job with deciding to guide people even after they clear the ORE exam. Thank you, Dr. Sudheesh, for doing that thing. Is there any advice you want to give to someone who's seeing this video and thinking, I want to go to UK?
Right. So, yes, I would want to give some advice to those who are, there are two types of students who contact us. One who have no clue what they are into, and they just want to know, I'm thinking of doing the ORE. What is your opinion? And there are those who have thought about it very well, and they are stuck in some way and they need help. So my first advice would be to plan what you want to do in your career and why do you want to move out. I have my friends who are doing really well in India with their practices. So it's not just that you can say that the UK is very good and I'm going there, I'm leaving India and going there. That's not the case. There are a lot of other factors which come in if you're moving. So work out that first. Have a strong motivation for you to move to the UK. If that's the case, definitely then do your basic research. That's the second thing I would say. Almost around 80 to 90% of information is there on their website. That's the beauty of how they provide information in the UK as well. They give every information so that you don't have any doubt with what you're going through. So I would say, go through their website, or each and every information is there on that. And if you have any doubts from that, then we are active on NS2 Academy on the Instagram. So you can pop in with your questions, and we are really happy to help you with that. And also, if you're going for any courses, even that you can inquire about that first. Just make sure you are happy with what courses you are taking, not just that someone suggested and you're just going blindly into it. Just make sure what kind of course it is. If you are really happy, you can commit to it, all that. So it's making sure you're very clear going for the exam. If you're not clear with that aspect, then I'm not sure how well you're going to prepare for your exam as well. If you're not clear, that reward of getting into UK should be very strong. Otherwise, you're not going to be preparing very well.
That's very good advice. I'm sure that you're, by teaching so many students, guiding so many of them, that's where you come to this. Clarity is always important. So if you're clear about what you want to do, that is where people like Dr. Sudheesh can come in and guide you and help you get into it. If you think they are going to study for you, it's not happening. You have to have that intrinsic desire. I want to move to the UK, and I think Dr. Sudheesh is the right person to help me. When you feel that, I'm sure he will guide you to the steps and help you get out there. If they want to contact you, is it advisable for them to ping you on Instagram? If that, then we'll post.
Contact us through Instagram if there's any additional requirements, and we can add them to a common group there where there are like-minded people over there, and then we can have further discussion. But most of our networking is through Instagram.
Great. So we'll be putting the details of their Instagram page on our Instagram page. This post will go as a collaboration. So anyone has doubts can easily contact them. They're very approachable. I send them a message. I got response quickly.
Okay.
If you like this video, do not forget to check out our entire UK After BDS playlist.